I'm going to talk about drug abuse in Zimbabwe. Drug abuse is now a serious societal problem in this country. It affects up to 60% of those who are abusing drugs are youths, although it comes across all age groups. Why the youths and what are the causes of drug abuse? For the youth, the first cause is peer pressure, and also followed by the economic environment, difficult economic environment that we are currently experiencing as a country. So for a lot of youth, drug abuse becomes a coping mechanism. We also have poverty, which also links to the economy. Poverty also pushes people to drugs. And then we also have instances where we have lack of awareness, support for people not to engage in drugs. Then we've got mental health issues. Here we are talking about depression. A society that is depressed because of, like in this country, it's because of the economic environment. It creates mental health, and as a coping mechanism, a lot of youth get into substance abuse. And also, most of these substances that are being abused in this country are very accessible and they are very cheap. The other item that causes drug abuse in this country is stress. People unable to cope with stress get into drug abuse. Briefly, we can go into most of the drugs that are being abused in this country. So we have the cannabis, mbanje, which has been abused for a long time and it's grown here. And we also have prescription drugs. These are drugs that are being abused. Normally they are supposed to be bought under prescription, but because of lack of enforcement, we also get a problem where the people just are able to access them over the counter from unscrupulous pharmacists, or some of it is just smuggled into our country through our porous borders. Right. The other external drugs that are found is we've got the cocaine and we've got the heroin, which they also call guka in this country. What are the consequences of drug abuse? We've got mental health disorders, we've got cardiovascular issues, we've got the risk of infections, that's maybe of HIV, and we've got families that are breaking down because of drug abuse issues. Then we have got domestic violence, which is hardly a day goes without someone reading about for domestic violence. And then we've got the economic impact of drug abuse in the whole country is estimated at 780 million, which is quite huge. In social marketing, the intention or the main focus is to influence behavior, to have behavior change. So drug abuse in social marketing, the focus is actually to make people change their behavior, those that are already addicted or those that are thinking or have not yet been. That is in terms of the awareness. So we've got the product. The product in rehabilitation services, like for give an example, in 2023, all 67 rehabilitation centers in Zimbabwe were full, and the capacity was 5,000. But many more couldn't access this rehabilitation. So what is now important in social marketing is to offer counseling, therapy, and to have support groups for the addicted people. Then we've got awareness campaigns or education, awareness programs to advise communities on the dangers and how they can also fight drug abuse. The other aspect in terms of product is to provide access to medication, especially through the state. I'll give you an example of there is a center that has been created at Stodato by the First Lady, where those addicted are admitted and they get services. They've got access to medication, mainly assisted by the foundation, and they get detoxification services. They get aftercare services as well. Now we then look at the other issue. I'm talking about the 4 Ps. That is price, right? Well, the price must be affordable for people to participate in this in rehabilitation. So I've given already an example of the one installed at all, and it's already full because the people that are